everybody. I'm Mike McCartan, for those who don't know me. And just, sort of a quick intro of what we're doing here. As we've had our Kittery Dems meetings, we've discovered that there is a span of opinions and, in many of our cases, maybe a depth of unfamiliarity with issues. So we've come up with different topics that we're going to have forums on, just to kind of get people smarter than us to kind of speak to it and to kind of give us a lay of the land on different issues. So, tonight is the first of, subsequent to this, we'll be doing on affordable housing and the environment and education and other things. But just with sort of the preeminence of healthcare on the national, but certainly the local, state and local levels, we figured this would be the appropriate topic to kick off with. We will be filming the session tonight, and that's going to be, certain of our members are not here tonight. We are also seeking to put this on the local public television station. There's a little bit of a hassle with that there's even a Democrat kind of moniker on this, but we'll work that and try to get it out in one form or fashion. Last but not least, after our guest speakers sort of, give an introduction of their perspectives and the things that are important to them, we will then be opening it to question and answer. We're booked for 2 hours. We'll go as long, and I think 8 o'clock isn't necessarily a hard stop, but we'll just see how it goes. And I just want to welcome our guest tonight. Patty Hymanson is Maine Representative, District 4 in York. She's also a physician, and she chairs the Health and Human Services Committee at the State House. So we welcome Patty. Charlie Dingman is Vice President of the Maine Equal Justice Partners Board. He is 30 years of health law experience, but Maine Equal Justice Partners is an advocacy group. Charlie will be speaking to the Medicaid piece. And then Amy Gallant is the Maine AARP Maine Advocacy Director, and she will be speaking in terms of the AARP's Medicare and all that. So with that, I think I will pass it to Patty and let you begin, and we'll come across the table and then open it up.
Rather than deal with particular topics, which I will deal with when you ask me questions, I thought I would give you a sense of when you are in a legislative, when you're talking to a legislator, what are some of the things you should be thinking about? Does that help? Is that a helpful conversation? Okay, because I've seen all these public hearings, and I've seen the good and the bad. When you're speaking, know who you're speaking to, and why they would care about what you're speaking about. So if you're speaking to your local legislator, you have the local legislator, your representative, represents your district, and that person should feel like they know you and your issue because they are representing you. So when you talk to Dean in Kittery, and you talk to Mark, right, Lawrence and Elliott, or Mark and Dean are I imagine everybody here. Anyone else here from Jen Parker from South Berwick? Okay, or me, Lydia in York. We're all Democrats, but when you talk to them, you should know that they are in charge of taking your opinion and bringing it up to Augusta and speaking that. So that's a very personal relationship you have, and so you should feel that with them, that you are telling them something and they are representing you. Now, of course, you're saying one thing and the other person's saying something else, so they have to decide, kind of on balance, how they're representing the district. So you should know that. You should know if they're a representative or a senator. The senator is Dawn Hill. She's termed out this year, so there'll be a big race for who's going to take that position next time. The important thing is to ground them in the district. So tell them a story about what's happened here to you, to a place here. When I give this talk to physicians, which I just did this past weekend, I say, tell them, the patient of yours lives in the district. They go to a hospital in the district or right next door. And this is a story that relates to them and the district. It's really important to have those constituent stories. When you talk, try to talk heart, head, heart, meaning you start out with a story that's compelling, that's a personal story, then go to some statistics somewhere, watch for eyes glazing over, and when you see that happen, then go back to the heart and finish up. So that's a good plan. If it's a committee member, somebody who is not your representative, a committee member, that's a more partisan position. So you will be aware that, and when people talk to me as a committee member, I'm taking care of the whole of Maine, as is everybody on the committee. So they're going to come at this from a very partisan direction. And generally, when we have vote outs in the committee, they are partisan. So understand, if you're talking to a Republican, what that position is. As an example of what might surprise you, there was a vote about, it's come up a lot of times before, about tanning beds. So tanning under the age of 18 is very dangerous. It primes the skin for melanoma. And we had a big public hearing with oncologists and dermatologists, parents whose kids died in their 20s from melanoma because they were in tanning beds, kids who came up in their 40s who had melanoma, who tanned in tanning beds. It was compelling. But the Republican view is, don't tell me what to do. It's a nanny state. Parents should be able to figure this out. Kids should have this conversation at home. So you would think that that was a compelling medical story. But the reason it was voted down was because of the nanny state. So something different. So when you're talking to somebody, understand where they're coming from. Because if you just rant your thing at them, the hard thing, they're not listening. So you want to get a sense of where they are on the particular, if you're talking to a committee member, and they might not be your representative, and they might be from a different party or coming from a different place than you are. So be careful of that kind of rant when you do that. Acknowledge counter arguments. So when you start, make sure you're aware of counter arguments and you give them a full throat. You say, I have thought of this. I know that people think this might be a nanny state, or people are telling their and I understand that. I'm aware, and that's a complicated, but on balance, if you use the word on balance, I believe that this is the better strategy to go. So, be aware that counter arguments can be compelling.
Patty, can you say what a nanny state means?
Oh, meaning that the government is taking care of people. That there's a law that is making people do something, and they should have that responsibility to do it themselves. So the parent should know this and should tell their child, you don't need a tan for the prom, or you can get spray tan, but it's dangerous to. So it's the same thing with the smoking under 21. 18-year-olds go to war, they vote, they should be able to smoke too. So that's the counter argument to, yay, what happened this year, which is now smoking, buying a pack of cigarettes is illegal under 21. So we got that through. Why, would you think? Because it came from the rural districts. The rural districts said, our kids are smoking too much. And there was a senator from Piscataquis County, very rural place, who has emphysema. And he said, if somebody had told me, maybe I wouldn't have started smoking. There was a representative from a rural part of the district who was crying in her floor speech that her dad died because he smoked all the way through his life, and maybe it would. So these kind of arguments kind of sometimes are compelling and rise up from some other place. But you have to be aware of it. To be a good advocate for your own position, you have to be aware of that. If you're going to be intimate in your conversations. I'm not talking about a mass rally where everybody's got the signs up and everything, and you want to see it big. But if you're going to be intimate in your advocacy, you want and not get somebody to pass you over. So the most important discussions are held in the committee. So if you really want to get something done, you show up to the committee where the bills are. Because once the bill is voted out, if it's voted out of committee, unanimous ought to pass. It sails all the way through, generally, until it hits the wall with the governor, and he vetoes it, and then we have to override it. But if it's a unanimous ought to pass, generally, if it's a unanimous ought not to pass, it's dead. If it's a partisan vote on party lines, it's probably also dead. It's unusual. What that sets up are really great floor speeches, because then people know they can just kind of rise and, do their thing on floor speeches, and that'll happen on both sides, so you get a really big discussion about the bill. But you want to get a really good vote out of committee. That's important. So the public hearings and the work sessions are important. So if you know of a bill that you're following, and you come to the public hearing and you say your thing, you have 3 minutes to say your thing. 3 minutes is one piece of paper. Don't speed through it. Make it so that you're able to talk and give it its due. But in Health and Human Services, we have big public hearings, so we limit it to 3 minutes. So you say your thing and you sit down and you've done it. The other part is to come back for the work session, because that's where we work the bill. That's in a few weeks after the public hearing. And we invite people to come up. It's not, no one can come up and talk when they want to. We invite people to fill in the gaps of our knowledge. And then we generally take a vote. That's when the vote happens, in the work session, not the public hearing. So it is a commitment if you're following a bill. How do you follow the bills? A great website, legislature.maine.gov. You go on, you put in the LD number, legislative document number, or the title of the bill, or just, if you healthcare, and then you'll find all of the healthcare bills, and you scroll through them, find one that you like, read it, just click on it, read it, you can see where it's gone, and then come up to, find out when the public hearing is on the website, read the bill, come up to Augusta, wave at me, say, come on, sit down, and talk if you want, just listen, see how it goes, come back for the work session. But pick a bill and follow it through to see exactly what that looks like. And then you'll be interested in when it comes to the floor a month or two later, what happens to it, what the vote is. You can sit upstairs and watch the vote happen, listen to the floor speeches about whatever it is. So it's a big process. It's one that you have to commit to if you're going to follow a bill through. But it's really, at the end of it, you'll feel inspired. But it does take commitment.
In general, how much weight does public testimony carry?
Oh, it's huge. The way that we're organized on public hearings is people come up first to present the for argument, so in support of the bill. And then when that's all done, then people come up against the bill or opposing the bill and give their arguments. And then when that's done, people come up neither for nor against to give information that hasn't been given to us before. So by the end of that process, you really get both sides and the neutral stuff.
In the healthcare arena, how much bipartisanship is there in Augusta? Is there any? What's your take on that?
Yeah, it depends on the issue. As I talked about with the smoking, that's a public health issue. Generally, it's not bipartisan, but somehow, this came up through the rural parts of and it did. We had a big restoring public health nurse bill that made it through. I never thought it would make it through, but that was one. Senator Brownie Carson, if you ever meet him, he is a force of nature, and he really, stood with that bill and worked it. So it depends on the issue. Some are completely partisan, never make it anywhere. We give big floor speeches just to get the issue out and, where it's contentious, and let that be that.
Okay, Charlie, you please.
Thank you. It's great to be here. Probably before I start, I should explain a little bit more about who I am. Representative Hymanson was very kind to say that I'm one of the lobbyists who stands for social justice and other good things, and that's true in my volunteer role. I am, however, a lawyer with a private law firm, Freddie Flaherty, with offices in Portland, Augusta, Concord, and Boston. We represent a lot of corporate clients, and so in my day job, I do get paid to go talk to Representative Hymanson and others by people who have strong economic interests in those outcomes. So I'm familiar with both sides of the fence, if you will, with regard to lobbying. In my dream world, lobbyists' job would be entirely focused on marshaling the facts and presenting them to legislators so that they can make good decisions. And everybody would have a good lobbyist, whether they happened to have a lot of money or not. And that's why I'm on the board of Maine Equal Justice Partners, which is a legal services organization that represents low-income people in Maine. The mission of Maine Equal Justice is to find solutions to poverty and to represent the interests of low-income people in Maine and advance those interests to the best of our ability. Maine Equal Justice is the legal services organization that provides services that are focused on impact for as many people as possible, looking at systemic legal issues and trying to solve them with class action litigation, with education of various people in the legal community so that they understand the issues that are faced by people with low income, by administrative advocacy, working with departments like the Department of Health and Human Services to try to make the procedures work better, to focus on rules and how those rules can or should be changed or shouldn't be changed, the latter having been more of our focus in recent years as the administration has sort of taken aim at Medicaid, at temporary assistance for needy families, at food stamp programs and others that really help people who need a hand, and that the administration seems to think create a culture or impose costs that they're opposed to.
What is question 2?
That's question 2. Let me read it to you for starters, except of course that I've got security protection on my iPad, so I can't get to it. There we go. Question 2 is, do you want Maine to expand Medicaid to provide health care coverage for qualified adults under age 65 with incomes at or below 138% of the federal poverty level, which in 2017 means $16,643 for a single person and $22,412 for a family of 2? Do you want to do that? In other words, do you want to enact an act to enhance access to affordable health care, an initiated bill that was placed before the legislature by the required number of signatures, and I want you to know that the required number of signatures were gathered in a single day, on Election Day 2016, in response to volunteers circulating those petitions at the polls. In one day, we had enough signatures to bring this to the legislature and, should they fail to pass it, as they did, bring it to you, the voters, on November 7th, 2017. Now, the legislature could have and would have passed question 2 by a majority of both chambers. Even though one chamber is controlled by the Republicans and the other by the Democrats, we can be pretty confident that we could have had a majority vote in both chambers supporting this legislation. Why do we know that? Because 5 times in the past several years, the legislature has, by comfortable majorities, passed bills to expand Medicaid to provide health care coverage to the 70,000 people who will be covered by question 2 when you pass it at the ballot box. Why didn't it become law? Because we have a governor who has 5 times vetoed that legislation. It's such common sense legislation. It's so good for the economy and so good for our society that we came very close to overriding his veto most of those 5 times. I can't give you all the roll call votes from memory, but I know that Representative Hymanson would agree with me, and so would Amy, that we came very close. We came within a handful of votes. So this is an opportunity to expand the number of people in our state who have health care coverage by 70,000 people for a very small general fund investment. What are the benefits of doing that? Well, the obvious benefit is a healthier community. Lots of people who now face serious health care conditions with no way to get appropriate coverage until it's so serious that they present themselves at the hospital and get charity care. And that charity care, as I assume you all know, drives up the cost of everyone else's health care coverage because that expense has to be covered somewhere. So it tends to drive up health care insurance premiums for people who are paying privately. So you have the dual benefit of covering 70,000 more people who can go get care before it becomes a crisis, and at the same time stabilizing or avoiding additional increases in health insurance premiums for other folks who are either getting subsidized premiums now or are paying full premiums depending on their income. The additional health care that would be provided would generate an additional 3,000 health care jobs in the state of Maine. Not surprising, because we're talking about $500 million in federal Medicaid spending in Maine that's not happening now because we've said no thank you to $500 million of spending. We've already said no thank you to $1.2 billion in federal health care spending in our state. And we'll say no thank you to another $500 million a year until we do this simple, sensible thing this November.
Is this referendum binding, or could you play the way they did other referendums in the past, like ranked choice, etc.?
The people of the state, when voting on a referendum, have the same power that the sitting legislature has. So the result is that, yes, it becomes law when you act on it at the ballot box, but the next legislature has the power to modify that law and amend it, which is actually a good thing, because there are obviously uncertainties at the federal level right now. There could be changes in the program. The legislature might have to fine-tune or tweak this law to make it work with whatever the new or revised federal requirements are, as hopefully some sensible legislation eventually emerges from Washington on these issues.
How about the governor?
The governor does not have a veto on an initiated bill. So the governor cannot veto this measure. It becomes law as a result of your vote at the ballot box. So what happens?
My day-to-day is state advocacy. We count on our 230,000 members, our many, many volunteers. We should get a count on how many volunteers we have, and our community partners to really bolster our work across the state of Maine. There are only 5 full-time employees here in the state office. That's the smallest state office that they'll staff is 5, and here we are 5. So I want to share with you some of the work that our small office and our many, many volunteers and large number of members have been working on in regards to healthcare, both at the federal and the state level. Healthcare has been a top priority for the current administration in DC, and we have very actively participated / opposed many of the more concerning cuts and proposed so-called reforms. I want to touch on 3 today. The first is what we call an age tax. Did anyone hear about this, an age tax? So what the age tax is, it means that people between, and again, these are all proposals, none of them have passed. We call that a victory so far, and we will continue to work against all three of these, as well as any other detrimental federal health care proposals that come down the line. So the age tax. The age tax, quite plainly, people between the ages of 50 and 64 who buy health insurance on their own could be charged up to 5 times or even more than what someone under 50 pays. So if you think about this, this means that an older Mainer who makes $45,000 would have lost their premium tax subsidies and would have had to pay up to $14,000 more annually for their health care. So we are absolutely opposed to an age tax. The second concerning proposal, again, I want to remind everyone that this did not pass and hopefully will not. The bill would have allowed states, individual states, to waive important consumer protections, including what are known as essential health benefits. We heard a lot about this around pre-existing conditions. So anyone with a pre-existing condition would have been at risk if this essential health benefits would be allowed to be waived by individual states. There are currently 123,000 Mainers living with a pre-existing condition, including diseases, chronic diseases such as cancer, heart disease, diabetes. During this debate, my adorable nephew Liam was born, fully 2 months early, due May 23rd, born March 23rd. Sorry, Michelle, if I got that date wrong. And his birth as a preemie is a pre-existing condition. So from birth, the number of treatments, he's fine today, but the number of treatments that he had within those first 2 months by the angels in NICU, my goodness, NICU nurses are angels. If anyone here in the room is a NICU nurse, thank you. Liam would have been at a disadvantage would this have passed right from March 23rd. So certainly we're concerned about the age tax. We're opposed to any waiver, state waiver of essential health benefits. And the third is something that my good friend Robin Merrill at Maine Equal Justice Partners said for months and months and months. Per capita cap. Per capita cap. Did anyone hear about this? Just Robin? The per capita cap is, again, a state allowance that would have put a spending limit on each individual. So Medicaid is a lifeline for 268,000 Mainers of all ages, including individuals living with disabilities and low and middle income older Mainers who depend on it for long-term care at homes and in nursing homes. And the per capita cap would significantly have decreased the ability of these 268,000 Mainers to meet their needs, and any Mainers going forward. If they needed to access health care, this per capita cap would have been very, very damaging. So those were three of our many concerns. I want to go a little bit to state and then back to heart. At the state level, and I'm happy to take questions about federal, my jam is state, so I might have a couple texts with Elise over here. I brought everything that I know about federal health care, but if you have any questions about federal, certainly speak. If you have any questions about state health care advocacy, I'd love to talk about that as well. A couple things that came to mind. We hear from our members all the time about the cost and the transparency and the importation of prescription drugs. We know that this is a huge issue for many of our members and their families. Our members along the northern border ask us all the time, what are we doing about importation? We're working with Representative Sept on a resolve to address drug importation and with prescription drug costs and the transparency of those costs. We're currently serving, we have 3 volunteers and advisory council members who are serving on a task force that the Judiciary Committee convened in these months that we're not in session, that the legislature's not in session, to address many, many bills that came forward from legislators on both sides of the aisle to really tackle this prescription drug cost, transparency of cost issues. So those are both issues that are ongoing. Senator Brownie Carson, as Representative Hymanson mentioned, championed a public health nursing bill. Public health nurses come into our homes and make sure that we're well, from little preemie Liam to my grampy who's close to end of life. And there are many current vacancies of public health nursing positions that are funded and they're just vacant. So you would think that this would have been an easy one, but I echo Representative Hymanson's praise of Brownie Carson. He was a champion and pushed this through. So public health nurses are going to, those vacancies will be filled. We also work year after year to increase the wages of home health care workers. I heard a fabulous speaker a couple years ago. She said, at a conference, she said, for me to be here, someone has to be home taking care of the most important person to me, and that's my mom. And the most important person to me in the whole wide world, my mom, is being cared for by someone making minimum wage, who likely has to go to another job or is coming from another job, and that's wrong. And that has stayed with me for probably 5 or 6 years now. This again is a bipartisan issue. This year we saw bills submitted by Ellie Espling on the right and Eric Jorgensen on the left. A couple of the bills were carried over. We also, and I'll just touch on this briefly, are always looking to support in new and creative ways family caregivers. And what we mean by family caregivers, anyone taking care of a loved one at home. There are 178,000 family caregivers in Maine right now. 1 in 6 Maine women is a family caregiver. Many men are as well, but it does tend to be a family role that does fall upon women. And many of those 178,000 family caregivers are going it alone. They're at home with their loved ones, saving the state billions of dollars and allowing their loved one to live well at home. How can we better support you? How can we better support each other in this effort of family caregiving? I did bring some Maine family caregiver resource guides over here, so please feel free to take one.
This is for Charles and everyone. I'm concerned about question 2 and being, I like support question 2, but I'm concerned because there is such a strong kind of anti-welfare voter in Maine that elected LePage. And even though it's not, and I don't even think it's the idea it's not cash, it's the idea that somebody's getting something. And I have a feeling this PAC is going to come, hard and talk about how it's going to bankrupt the state and all kinds of stuff like this. And I guess my question is, I don't fully understand it. And I don't think a lot of people fully understand how Medicaid works and, like how you qualify and so forth.
So
Try to summarize.
So to summarize, I think the question really is, how do we respond to the critique of expanding Medicaid that goes along the lines of this is welfare, these are able-bodied people who should be out working, it's going to bankrupt the state because it's so expensive. Basically the general anti-welfare theme. How do you respond to that? First of all, and I'll try to get to, and the question also included, how does Medicaid work and what are the specifics? I'll try to get to some of that too, but some of the really sort of bedrock answers that you can give are, first of all, most people who are on Medicaid now, and most people who would be on Medicaid if we expanded it, are working now. They're just not making enough money to afford a health insurance premium. That's why Medicaid was expanded by the federal government to include more people who just can't afford health care unless we provide some help. So this is not a matter of saying, oh, these are people who are lazing around and they're going to get health care. No, they're going to get health care because they're either working as hard as they can and it's not getting them enough money to afford health care, or they're already sick or in some other way unable to work for one reason or another, nobody is going to stay home from work or choose not to work and be utterly impoverished so that they'll have health care coverage in case they need it. That's just not, that's just absurd. And we have to counter this idea that somehow providing people with a basic human need, like taking care of yourself when you're sick, is going to create a culture in which people don't want to work. This is not a program that's going to somehow lift people up to a standard of living that would be acceptable. This just provides health care coverage. Health care coverage is what the Secretary of State has wisely chosen to call this in phrasing the question. And that's exactly what it is. It is not welfare. It's health care. Health care is something we know everybody should have, everybody needs, and that if we don't give it to people, we end up with people who can't work as much as they otherwise might, or we end up with children who are affected by a health care condition and unable to learn and grow the way they should. Nobody wants that. And that's what we're talking about here. So I think that's one answer. Another answer is, let's not talk about bankrupting the state. Let's talk about economic development. When we expand Medicaid by passing question 2, first of all, we'll save money on programs that are now entirely state-funded that will instead be funded through the Medicaid program. On average, once it's fully operational, which would be in state fiscal year 19, that would save about $27 million a year. So we're going to save some money. Yes, we're going to spend some money, but it's a modest amount compared to the $500 million a year that the federal government will spend in Maine so that more people have health care. And in order to provide that health care, we're going to employ 3,000 more people in good-paying jobs. So no, this isn't going to bankrupt the state of Maine. This is going to do something we need to do to help people who need the help, and we're going to invigorate our economy by doing it. Law enforcement, if you ask law enforcement what we need to do to combat the opioid crisis in this state, they will tell you we need Medicaid to cover people so they can get the treatment they need. That's the most important thing we can do to combat the opioid crisis. So there are real compelling social reasons to do this. It's going to save money in the end.
Can I just respond to that a little bit? Because you are right. There's going to be... This weekend I was at the Maine Medical Association's annual meeting, and LePage was there talking for about, a half hour. And some of it was about Maine Care expansion. And he spoke in untruths. I don't know what to say, what other words you use, because I don't like to use the lie word. But they were all untruths. And so you will hear things like he said, which is 40-something states in the United States expanded Medicaid, and they're all really sorry that they did because now their states are in trouble, which is a complete lie. There is no state that has pulled out of Maine Care expansion once they've started it. No state has pulled out of it. It's not like they're locked into it, and if it goes all wrong, they wouldn't say, this didn't work, we're going to leave this. None of them backtracked. These are Republican states and Democratic states. So when you hear that, it is not true. And he says that just exactly as I said. And I was, floored. So he also talks about, there are a few things, that it'll bankrupt the state. He has these bumper sticker, sayings, it'll bankrupt the state, which is not true. But it's an easy bumper sticker. So we do need to find, bullet point, easy ways to combat this. we'll get there. We have until November to get these kind of easier ways to say it, but it will not bankrupt the state. In fact, it brings in economic promise with new jobs, people who are actually treated for their chronic diseases, people who are diabetic who can't afford their insulin and they're poor and they're working, and they have to go to the emergency room to treat their diabetes when it gets out of control because they can't afford it. People who are addicted to opiates who cannot afford their treatment.
And what we're really talking about when we talk about question 2 is Medicaid, which is the program of health insurance that the federal government created for those with low incomes and the elderly. And it's separate from Medicare, which is a general health insurance program for all of those over age 65. So there's those two programs, and there's overlap when it comes to long-term care for the elderly, because Medicare covers skilled care and general health care, but doesn't cover long-term care, which is covered by the Medicaid program. The Medicaid program is a state-federal partnership. It requires state spending as well as federal spending. Medicare is 100% federal and funded through a payroll tax. So,
I'm sure, or I assume, that each of you favors universal health coverage, either federally or in Maine. However, I heard none of you speak about best delivery of that. Could each of you address how you feel or your organization feels about single-payer health insurance, please?
Yeah, I've been a single-payer advocate through my medical career. I ran a practice for 30 years, and I listened to my biller, have these crazy conversations with patients about who is going to pay when and the prior authorizations, and it's just crazy to have this huge layer of administrative cost with multiple plans that no one can figure out, no one understands them. I went to a healthcare conference sponsored by Milbank Foundation, and it's a states group, so there were 14 states represented, and Canada and Australia. So whenever we would talk about something insurance related, we would hold our heads and talk about, and Canada and Australia, they would lay back and sit there and say, tell us when we can come back and talk about real medicine. It was such a, it's just, I always used to say that there's a code, everything gets coded, everything has a code now. There's a code for the stress of using health insurance. Because, you're sick, everyone has a health care story, everybody. And it can be really bad, the story of how you lose all your money and you go bankrupt. I go into the bagel basket in York, and there's this bucket there with money in it, and this picture of a high school student, can you put money in here because her parents can't afford the copay? And why? Because she's down in Boston with her pneumonia, and it's an expensive hospitalization. So I said to the people behind the desk, that's really sad that you have to pay for health. They say, no, everybody comes in, they're really happy to do it, put the money in. I said, wouldn't it be better if we were put the money toward a tree in the park? Not money in a bucket and in a counter in a bagel store to save a girl's life. I mean, how sad is that? What ethics do we have as the richest country in the world? It's just so, so I have for a long time been, Medicare expansion, everybody in, nobody out, it just makes sense. So we talk about the things in the same way. You're on a bus, the person next to you is getting the same health care as you do. And you can talk about it in the same way. Everybody understands it. It's not different. You don't have a different card. It's crazy, our system. But let me just also mention that we are far apart in a partisan way between single payer and the marketplace, right? And I had this result of a survey done for Democrats and Republicans, And we are just really far apart. These are legislators, both state and federal. But the thing that we are the same about, Republicans and Democrats. I always look for where can we start this conversation. It's cost. We are all concerned with the extraordinary cost of health care that is different in our country than every other country. So how can we deal with that cost? For the pharmacies, the insurance companies, the hospitalizations, everything about it. We are trying to use insurance to pay this open pit of expense, which is our healthcare system. And we all agree with that. So that's kind of the direction I want to go. I totally am supportive of single-payer health. I don't think, we can talk about it, we really should, but as a legislator, where can I move that would be maybe get some meaningful change? And it's really in that lane, decreasing cost.
If I can add to that a little bit, there unquestionably has to be, as the end goal, providing health care coverage for everybody. And the single-payer model is one logical way to do that. If we had the political consensus to use that method immediately, it would be easy to go in that direction. But we have to remember that we do have, as Representative Hymanson said, some significant partisan differences of opinion, different levels of confidence in what we should entrust to the government and what we want to entrust to the marketplace. Other industrialized countries have solved that problem in a variety of ways. Some countries have a single government health service that provides both the delivery system and the financing system for everything. And there's a good argument to be made that that's an administratively simple and inexpensive way to do this. Other industrialized countries, and then the ones that come to my mind immediately are Japan and Germany, but there are others, have chosen a more hybrid approach where they've basically taken a government regulatory approach and said, we're going to subsidize insurance so that everybody can get it. We're also going to tell the insurance companies how much they're going to charge, and we're going to tell the providers of health care how much they're going to get paid by the insurance companies. So you might have multiple health plans, multiple providers, but you have a top-down regulatory system that says, we're going to make sure this is affordable, we're going to control those costs, and we're going to make sure everybody is covered.
The HHS committee, if you're brief, you able to start. AARP has not yet taken a position on single-payer health care because it hasn't been proposed yet. So if and when we see that as a proposal specifically coming to the floor of the House or the Senate, we will comment at that time. If that's something that you believe strongly in, absolutely contact us. There's an annual process by which our members are the ones submitting policy initiatives, and I'm happy to provide that link. I believe it's during the summer sometime. I'm not sure if it's already passed, but if it has, then there's always next year because this is going to be an issue for a long time. But the short answer is we will comment when we get there.
How about cost control?
Oh, absolutely. I agree with much of what was already said. Cost control, access and affordability for not only our members but everyone in their family.
Right.
A quick comment, Charles. When you were discussing single payer, you consistently use the term free market. We do not have a free market in medical care. As a matter of fact, we haven't for years, but you use that term, and I would suggest that as a political matter, we should change to the insurance system.
Yeah.
When you're talking single payer, you should say it's either the insurance system or single payer.
Right.
To characterize the system as it is. It's a three-party system. One person pays, one person gets the care, and one person gives the care. It's not a free market. It doesn't even approach any economic system. So don't let Republicans use that. Second thing is a question for Amy. Amy, throughout the political process, we are seeing an increasing number of people just plain make false statements.
Oh, yes.
And I will give you the perfect example was the death panels by our dear former governor in Alaska. But one of the things that really bothers me is when AARP publishes information, they stay away from something like that. They never said, never once did they criticize the term death panels when they knew darn right well that they had nothing to do with death panels. And my franchise to AARP is if you people really want to be a serious advocate for people, you need to start by providing information to the members that debunks so many of the myths that are out there. This is a complicated system, and it is ripe for lies and distortions. But they need an honest arbiter that can, at the beginning of the magazine, these are distortions, and then say it.
It's about lobbying and lobbyists, okay? Because we all know that there's a huge number of them. Some of them are not really very public-minded. And the area that I wonder how much impact they have is the pharmaceutical industry in terms of healthcare costs. And is there a way for somebody like myself, who's really not, a genius at this stuff, to figure out who are these groups of lobbyists and how much power do they have? And are we looking in the right places when we want to talk about change? Because I think sometimes there's perhaps a group of lobbyists that are really the bad guys here. And I want to smack them.
Let me give you an example of two bills. One that I'm working on now. On Friday I'm going up to Augusta to meet with a group of people, because Maine's a huge state, so I travel a lot. But the bill is about repurposing medications that are in nursing homes, prepackaged in those little foil things, that get thrown away, right? By a lot of them get thrown away. We have to be able to do something with those, to repurpose them for somebody who can't afford medications. What I just said makes sense to everybody. But once you give a medication to somebody and it's prescribed, it's that person's, even if it's in the little foil package. And you can't then say, now I'm going to give that to someone else. Even if they died or they don't need it, they threw up the first pill and they have 90 days left over, it's still theirs. And so they throw it away. But that makes no sense. So we're trying to figure out how to make sense out of that and have some kind of pharmacy that those can be sent to, so that if you come out of a hospital and you can't afford your prescriptions, then you can get this medication sent to you, or you can go pick it up, some kind of dispensing pharmacy. So we're trying to put that in place, and we're meeting about that. So this is one idea. Like I told you, I'm looking for ways to decrease the cost of medication. So this is one idea.
So what a lobbyist is someone who is paid to speak with a legislator, the governor, another elected official, or their staffers for at least 8 hours a month. So if someone goes to the legislature as a private citizen and you're not being paid, and or you're there fewer than 8 hours a month directly lobbying, directly asking for an elected official to vote in a certain way on a certain issue, you're not a lobbyist. So that's kind of the threshold of who is and who is not a lobbyist, and that's a Maine Ethics Commission definition. It's in statute. Once you hit the 8 hour a month threshold, and that's not driving, that's not preparing, that is direct lobbying. Once you hit that threshold, once you hit 8 hours, you have to register as a lobbyist. So you could go on the Maine Ethics Commission website and find a complete list of anyone at the State House who's spending 8 hours or more asking elected officials for their votes. Furthermore, those of us who are registered lobbyists and go to the State House have to report on a monthly basis how we're spending our time, with whom we're speaking, about which bills, and that does include things like driving. So you can see how many miles we put on our cars and how much we're being compensated for that. Which bills, and you can look it up by lobbyist or by bill. So you could go in and say, I'm interested in who worked on this particular prescription drug bill, how many, and then you could dig in further. So there is a level of transparency that is, it's complicated, but it is available on the Maine Ethics Commission website.
You had a packet of 211 bills that were presented this year. I have probably never heard of a single one. You're talking about engaging the legislature. How can I engage the legislature? I have no idea of what's going on there. So my question is very, very simple. Is there one news source in the state of Maine that you'd recommend that's covering what's going on in government?
There are there are a number of committees of jurisdiction. Health and Human Services is one. There's judiciary. There's criminal justice, and we had 208 bills. Judiciary probably had 80 bills. Education committee probably had 80 bills. So there's a lot that comes at us.
Yeah, I know.
So it depends on.
How do I get it filtered?
It depends on what your personal filter is. And what I would suggest is that you go on legislature.maine.gov, and in the text part, you put in what you want to filter it. So if you are interested in medications, you put medications, and it'll show you all of the bills that come up.
But imagine trying to do that in general, for your news. I don't have hours a day to go through.
And it depends on what
I don't even know what filter to put on, because I don't know what's really important, and often things that are important have a very low profile because people don't want you to know about them. So isn't there somebody, a newspaper or a website that is keeping an eye on all this stuff that you can go to that gives you a good overview?
I think what would be good, because there's just so much and everyone's filter is different. One person is totally about solar energy and another person is totally about single payer, or somebody's totally about the condo laws. Everybody is different. But what I would suggest is that the organization in Maine that best fits your own filter, maybe it's conservation, then you would join the Maine, help me out, the Conservation
Resource Council of Maine.
Thank you. And they put out in their newsletter all of the bills that are germane to that organization. If you're interested in how local government works, the Maine Municipal Association, the MMA, has a very good website with a newsletter every month, and they track all of the bills that are important for them. I think if you find the organization that's most closely associated with what you are interested in, and look at their website, they will take you through. And then you could call them, call the executive director. I'm most interested in land trust, in the land trust issues, or in climate initiatives, resiliency in the seacoast, or the lobstering, or water acidification, or legalization of marijuana. All of these things, as an interest, you can get from the organization that is most associated with that.
To go to your specific question about how do you make sure that once this passes on November 7th, that it stays intact, the most critical thing that has to happen is it has to be funded. by the legislature in 2018. And the Mainers for Healthcare effort and Maine Equal Justice Partners in working on that effort will not stop with the passage of the referendum on November 7th. It's going to be very important for people who help us get that passed to stay engaged and involved and stay on the mailing list, and there will be opportunities to speak up, to call your local legislator, to make sure that there's tremendous support to fund it and to make sure that it remains a robust part of the law. But it's, as I said before, because the majority of the legislature has supported it over and over again, I think we can be very confident that it won't be substantially watered down. We just have to include it in the budget and get that through, and that's going to be the big lift.
And it is important that the number is great. If there's a 60% yes vote, that will always follow the conversation. If it's 50.5, that'll follow the conversation too, in a less supportive way. So the vote number is important.
Please.
Yeah, one of the things I'm concerned about with this Proposition 2 is the whole sort of idea that, Obamacare is history, right, with what's going on in Washington. So I think that's something, I'm not asking for you necessarily to comment, but I think that's something that you and those who are trying to get out publicity on this really need to think about, because I think in a lot of people's minds, we've moved on. Why would we bother to go back and modify Obamacare, join into Obamacare, because Obamacare is going to be gone?
Well, and I think there is an answer to that. The answer is Obamacare is not gone, that there was a robust debate about that, and that the Congress concluded there wasn't an easy way to come up with something that could pass muster politically and would actually improve the situation. So we still have the Affordable Care Act. Right now, it's more important than ever for us as residents of the state of Maine to speak our minds and add our voice saying, yes, we want access to health care for more people, not fewer people.
Right.
And that message is important. That message was delivered repeatedly and effectively through Maine Equal Justice and others who worked in coalition and directed that at Senator Collins. And Senator Collins has listened and responded in a very important way. And passing this measure is another way to send that same message to our representatives in Congress and to the broader political community, that people are out there saying, yeah, we actually want to provide more access to health care, not less. Well, this 1115 waiver that Amy has just described is a very significant proposal by the LePage administration to narrow and diminish the availability of Medicaid and to impose burdens on those who do avail themselves of Medicaid. It is likely, given the current administration in Washington, that it will be received favorably. There is a comment process both at the federal level and the state level. Maine Equal Justice has also filed comments opposing the waiver. We are somewhat pessimistic about the Trump administration not going along with it, but there are both state and federal law objections to implementing that waiver, and we're prepared to litigate those issues if necessary.
I'm happy to pass around our letter if you want to peruse it as we sit here.
Would you like me
So I would, yes, thank you very much. And if you can hand these back to me tonight, I very much appreciate it.
So it's 8 o'clock. I'm just with due respect to the speakers, I don't want any holding them up, and I know they have drives ahead of them. So what I would propose.
I don't have a drive, so I'm happy to
stand. So I would say, if we could, either if we just stand down if there's still questions. There'd be small groups of people want to come up and just grab one of the speakers in particular. So
very good meeting.
Thank you to Amy, Charlie,